Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hello everyone and welcome to Your World Today. My name is Ofelia de la Torre and I'm very, very happy to be here with you.
I'm Kerrigan Von Polia and I am equally as happy to be here with you and with you, Ophelia.
Thank you so much. We're going to have fun. We're going to talk about germs.
I think it's a great show. It's a lot of important information. Should we get started?
Yeah, I can't wait to talk about germs. So to do that correctly, we are with the best of the best. Dr. Byron Williams from White Memorial Medical Center. He is a specialist and he's the germ doctor. Doctor, welcome.
You guys are making me blush here.
Well, we're excited to have you here, Doctor, and we're going to talk with you a little bit about the flu.
Yes.
And some important things for people to remember about the flu.
Well, it's important. I think that there is still a lot of confusion. What should I do? What is it? Is it really, I'm not going to get it, I am going to get it. Who's more vulnerable, doctor? So talk to us.
Well, in general, the flu is an upper respiratory tract infection, generally caused by a virus, influenza.
But it's true that there's many, many types of viruses out there? Is that what it is?
There are several types of viruses, but when we talk about the flu in general, we're talking about the influenza virus. The influenza virus is responsible for the vast number of infections, generally in the wintertime, in this country and worldwide.
People are concerned sometimes, I think, about a vaccine, which there is a vaccine for the flu. Should I get it? Shouldn't I get it? Will it make me sick? You know, what are your recommendations? What do you tell patients?
Well, in general, it's better to get the vaccine. It's much safer. Infections tend to spread much less. Hospitalizations are much less when the vaccine is employed on a mass scale, as we've seen in the past decade. I think it's a pretty standard thing now to recommend the vaccine to just about all
Doctor,
patients.
if I get the shot, will I be protected for the entire year, or do I have to do it again in 6 months?
Like a booster shot, do I?
Right, right.
Yeah, we generally do the influenza vaccine on a yearly basis. That's to the general public. We employ that as a policy at our hospital, and it's generally on an annual basis.
And will that keep me protected from every kind of flu, or is it a specific kind, a specific strain, I think is the word?
So it protects you against the influenza virus. It is the influenza virus that this vaccine works for and has the most activity against. And we're still working on vaccines for other types of viruses, but the influenza virus, as I alluded to earlier, is the most common for what we call the seasonal flu, and it is that vaccine we use
Doctor,
most often.
so help us destroy all these preconceived ideas, wrongfully, of course, of why people don't get vaccinated. It doesn't help. Or if they get the shot, they're going to get it anyway.
Yeah.
What happens if we don't get vaccinated?
So we've gone to a lot of care and detail to try and eliminate these types of side effects. And there are very, very few contraindications to getting the flu vaccine. Most of it has to do with allergy. Those that have demonstrated a valid allergic reaction to the flu virus, that's usually a contraindication. And it's typically those people who are allergic to eggs. But now there are new types of vaccines. One in particular is a recombinant vaccine that has kind of gotten around that allergic reaction. So
what's recombinant?
Recombinant, there are several kinds of vaccines.
Okay.
The influenza vaccine is what we call an attenuated virus, meaning that we've taken most of the disease-causing parts out of the virus to provoke your immune system only and to create an antibody response. Nonetheless, some of those viruses are derived, some of those vaccines are derived from egg products.
Oh.
And so there's a recombinant vaccine now that doesn't require that. It's made from other things that don't create such an allergic reaction.
So, doctor, if I get the shot and there's the predominant strain of virus, will I still be protected from other viruses? Because we still get sick, even if it's not from the main strain that year.
Yeah, you won't be protected from other viruses. You'll be protected from the influenza virus specifically.
So is the influenza virus one strain, or does that go into different strains and then it's really confusing?
Yeah,
We're not disease specialists,
Yeah,
so
no.
I'm confused.
the influenza virus is complicated because it goes through a series of mutations, and it is very contagious. The rate of mutation dictates how well a vaccine will work in a given year. Sometimes the virus doesn't mutate that often. And so in that year, the vaccine will probably have a much better chance of preventing disease. But when the virus mutates at a very, very rapid rate, there's a greater chance that the vaccine may not cover all the strains.
So there's some important key points, I think, for people to look at, and we have a graphic that'll show people some 3 main points that they can do to help themselves. So we talked a little bit about getting the vaccine itself, and then I think there's some preventative things that people can do. Is that right?
Yes.
So set the record straight, doctor, once and for all.
So
and you know what? I think we'll talk about it after the break. So we'll get to the
wow.
steps.
Hey, you have to come back.
Stay with us. This is important for all of us.
This is Your World Today. Thank you for coming back.
Well, we're here talking to Dr. Byron Williams from White Memorial Medical Center about the flu. And we were talking a little bit about the vaccine. And doctor, we want to know, is it important to get it? There may be some risks with getting it, but
Better
get it
to
or
get
don't
it.
get it, I guess, is the
right.
question.
Yeah.
What's the advice?
the risk benefit, the benefit is much greater than the risk involved. And I simply say that because there are a lot of complications that you can get from having the flu.
It's painful, doctor.
It's painful.
Yeah.
Very often you can get pneumonia subsequent to having the flu. Back in the days before we had medicine for the flu, hospitals were literally too full to even take all the patients that needed to be admitted to the hospital. So
And who's more vulnerable, doctor? Kids, older people?
generally people who have chronic illnesses, the very young, and the elderly.
And you mentioned something about the flu can turn into pneumonia, which sounds really scary, but how does that happen?
To be more clear, it can predispose you to pneumonia. It can, the virus can violate your mucosa and allow bacterial infection to then take advantage and spread in your body.
So, doc, how do I tell if I have just a little cold, or if I have an allergy, or if I have the actual influenza?
You have hit on a very, and I think it's a topic that.
Because then I know what medication to take, right?
That's right. Well, you hit on a topic there that causes confusion, and I think people aren't clear. What is the cold and what is the flu? And you can speak about it in general terms. The cold is usually less severe than the flu. The flu typically has fever, it has more severe symptoms. However, the same virus that can cause the flu can cause a cold. Generally, the common cold has a different group of viruses, but influenza can cause a common cold. So in between there is some overlap, and it's not always easy to tell which one you're dealing with.
You've mentioned a little bit about some of the things that we can do once we have the flu, how to treat it, what our symptoms are. Tell us a little bit about what can I do to not get it in the first place?
Okay.
How do I prevent the flu?
So I think the very first and the front line is to always get a flu vaccine.
To start.
To start out with. That's just the safest thing to do.
Shall everybody take the shot, doctor? Everybody?
Pretty much.
Okay.
From 6 months of age, in general, from 6 months of age through adulthood,
Okay.
with very, very few exceptions.
Now, how do we cough? How do we clean our hands?
Yes.
Are the antibacterial gels worth it? What's the spiel, doctor?
You know, the best thing is obviously soap and water. You want to wash your hands to prevent any infection. You know.
A length of time, the temperature of the water.
Exactly. You want to wash your hands with soap and water for
Hot
a period
water?
for a sequence of time that you would sing the happy birthday sequence.
I've heard that one, and I know that song, and I think
Do
a lot
you
of
know
people
the
do.
Happy
Yeah,
Birthday
I think a
song?
lot of people do. So that's a
Hot
good tip.
water, doctor?
Hot
Cold
water is better, but what's most important is soap and water. Not so much the temperature of the water, but soap and water.
Regular bar soap? Should I use some of the really strong antibacterial gel soaps? What kind of soap is going to make the difference?
You know, if you can just use soap.
Okay.
And if you can't,
Without degrading into
Right,
very
right,
complicated recommendations, you know.
if you can't get to soap and water, doctor, what's the second best thing?
So then the alcohol gels
Okay.
are next, and you'll see people carry them on their persons, and that's generally a safe adjunct as well to prevent the spread of the flu.
A lot of times I know people who have kids, I don't yet, but a lot of times it's children that are spreading these things. Do they get it more than adults, or is it just that it's more likely that they're going to spread it around?
It's more likely that they will spread it around, and therefore it's more likely that they will get it more than adults.
Okay.
Children just don't typically wash their hands.
Yeah, they don't know better.
Right, exactly.
So what about at home, without saying, the sprays that kill germs, do those work? Do we wash our sheets right away? What's the protocol?
Yeah, generally all of those mechanisms are good things to use. Lysol, for instance, has activity against the influenza virus. Washing your clothes. If you have the flu, washing your sheets, your pillows, you know, all of those add up to keeping you at low risk for getting the illness, for spreading it to your family members.
I take the sheets out right away and Lysol everything.
And I know when I get sick, I'm a bit of a baby, so I want my wife next to me. I want a kiss to make
You
me
want
feel
kishy
better.
kishy? Oh.
Is that going to get her sick? Should she stay away?
Well, in general, it's the flu virus is passed by respiratory droplet, it's passed by contact. And so there are mechanisms we use now to sort of prevent spreading it, and I'd like to demonstrate that with you, if I may. Okay.
Yes, I would like to watch.
So you remember back in the old days, it was cover your mouth, and not very long ago, that was the recommendation. We now recommend you cough in the antecubital area of your arm, and when you go to shake someone's hand, no.
No? Oh, got it.
Okay.
Okay.
That tends to reduce the chance of contact, along with washing your hands diligently.
And if we do ultimately come down with the flu, which we hope not, are there medicines that we can get from our doctor that'll
Yes.
help?
So in the last decade, a little bit more than over a decade, there's been a significant anti-influenza medicine called Tamiflu, and you might have heard it on the news.
Yes.
We've had very, very good results with that medicine. Even in times where I spoke to you before, the mutation of the virus was a concern.
Right.
Tamiflu has simply become the standard of care for
the
treating
influenza.
for the influenza virus.
Okay.
So-
well, with that,
Lots of good information.
Wow.
Preventative, if we do get the flu, what we can do, making sure we get the vaccine.
that's
I think
right.
That's a lot we've learned. Thank you, Dr. Williams.
Thank you.
Doctor, awesome.
Thank you very much for having me.
All right. So
Appreciate it.
we'll be right back. Don't go anywhere because this continues.